Hello, and welcome to Leadership PRN. This is the Dalhousie Faculty of Medicine podcast for leaders new and established. My name is Dr. Lara Hazelton. I'm a Director of Faculty Development within the CPD offices of the Faculty of Medicine. Today, I'm very pleased to have with us Dr. Mike Fleming. Hi, Mike.
Hi, Lara.
You and I work together in CPD, so it's a real pleasure for me to have a chance to speak with you. Can you tell us a little bit about yourself and your experiences in both clinical medicine and medical leadership?
Well, I'm the oldest of four. My dad worked for a national company, so we were all born in Montreal, but Montreal, Burlington, Ontario, Vancouver, and Halifax since 1967. Went to high school here at St. Pat's, and then St. Mary's University for undergraduate and Dalhousie for my medical training. I entered medical training in 1973, and so was part of the class of 1977, but then graduated with the class of 1978 and did a 2-year family medicine residency program here at Dal, and started practice with one of my residency partners, Dr. John McNabb. We started practice in 1980 in Fall River, and John has just retired from clinical practice 2 years ago, and no one will believe this today, but a year into my practice, I wasn't busy enough. And so went out looking for more work than was available in Fall River at the time, and bumped into the Associate Dean of Continuing Medical Education, Wayne Putnam, at the time, and asked Wayne if he knew of any practices in Halifax that needed an extra family doctor part-time. And he didn't really know anybody, but within a month, he gave me a call and said, "Are you still looking for part-time work? How would you like to come and work in continuing medical education?" So 42 years later, I'm still working in continuing medical education, now continuing professional development. I think in my own ethos, I've always believed that if you were going to complain about something, or potentially complain about something, you needed to get involved. You needed to be involved with the groups that you were. So as a result of that, from the get-go in practice, I was involved with the Medical Society of Nova Scotia, which is now Doctors Nova Scotia. I was involved locally with the College of Family Physicians of Nova Scotia, the section of general practice in Nova Scotia, which drew me into involvement with the Medical Society. So I've served from a perspective of the Medical Society. I've been on the board for a number of years, and then became the president of Doctors Nova Scotia in 2013-14, and the chair of the board in the following year. From the perspective of medical education, I have been involved with the College of Family Physicians nationally. I was chair of the National Committee of Continuing Medical Education for 7 years. We developed the Main Pro Plus guidelines that are presently in place, and they're at the present time they're being rewritten so that there'll be a new standard in the next couple of years.
Well, that's a lot. I think that's an amazing career, and a lot of people that you've worked with, people like you mentioned, Wayne Putnam, and I bet there were a lot of different deans and other leaders that you've worked with during that time as well.
Yes. Dr. McPherson, I think, was dean when I got into medical school, but Dr. McPherson, Dr. Murray, Dr. Rudy, Dr. McDonald, and the list goes on. Dr. Anderson being the last.
That's quite a group of people, leaders, and of course you've worked with different associate deans and other leaders throughout the years. Who were some of the leaders that you observed who were especially effective, and what made them effective in your perspective?
Wayne Putnam, I think, was one of the first ones. Wayne was associate dean of CME, and I'm not sure that they called it that then, or that he was associate dean, but that's how I would reflect on his role today. He let you do what you needed to do, was open for discussion about things that needed to be. He also helped me, or helped the group at that time, which was a very stellar group, reflecting back. But to work together, because there were divergent personalities and stuff, but we did very good work together.
That's interesting. So you say it was like a stellar group of divergent personalities. What made it that?
Well, I like the group was that I remember at the time was David Gass. David has had a strong career in leadership in medicine, but David Gass, Ian Purkis, an anesthesiologist, Lynn Curry, and Karen Mann, who were involved in research in medical education. We had a couple of rough bumps, and we needed to do a 360 leadership review or personality review, and then but that was good because it was taught us that we were different personalities. We reacted differently to questions and concerns, and we learned to adapt to one another so that we could work more effectively together. So that was a very interesting learning experience for me because I had never done anything like that before. And the associate deans that I've worked with over the years, Dave McLean, Don Langell, Jean Gray, Doug Sinclair, Connie LeBlanc, and now the present associate dean, Steve Miller. I outlasted them all.
A lot of institutional memory there,
yes.
Mike.
Yes.
I was interested in what you were saying about Wayne Putnam, of how he kind of gave you autonomy and space to do things, but was also there as a support if you needed him. Is that what your description, that's what it was like for you?
Yes. And Wayne was the first that did that sort of thing, but all of the associate deans were good people to work with and for because they let you sort of take your own lead, but work, under their supervision for the team and the purpose of the unit.
How has medicine changed in the years since you began working and doing continuing medical education?
Well, today that's an interesting question because medicine has significantly changed. When I graduated, the entrance to family practice was a rotating internship. The 2-year family medicine program was just developing at that time. And I did it, but I did it because where were you going to end up? Lord knows, and Alberta required that you had to have 2 years of postgraduate training in order to practice in Alberta. So I went the 2 years postgraduate training route to be open to wherever and whatever I wanted to do. Thankfully, I never went to Alberta, but so and the specialist route to training was more. You went out into general practice. You practiced for a year or 2 or 3, and then if you wanted, like Jock Murray, Jock was a family physician, and then came back because he wanted to do neurology. He felt that was more an area that he wanted to be more expert in. But that's changed significantly. It's everybody is in the beginning, and I feel possibly that the decision to where your track is going to be is asked too soon of our medical students because they haven't had exposure to all of the different aspects of medicine before they have to make a decision in the CARMS match as to which professional track do they want to follow. and it's far harder to get back into a specialty program now if you are a family physician and decide, well, gee, no, I want, like Jock, to focus on a special area in medicine. As a family physician, I always felt that some of the specialty consultations that we got were better from the specialists who had done family medicine as part of their professional career. They had a better understanding of what we were facing with patients sort of in the trenches, as it were, in the front line. Similarly, in medicine, in its broadest perspective, nursing has changed. When I started medicine, so in the 1980s, the nursing training was in hospitals. They had, there were nursing schools all over the place, and good nursing schools. They learned in a classroom environment, but also hands-on on the wards. And they changed, I think in about 2000, the nursing profession changed and decided that they wanted to go with a Bachelor of Nursing program. So that training in hospital, hands-on, has significantly altered. Pharmacy is in the process of changing and having a longer program of training before they graduate. The College of Family Physicians right now is talking about extending the program from a 2-year training program to a 3-year training program. I remember that the college has been talking about this for 10, 15 years. And I understand that we need more time possibly for training of all the different more seriously ill patients that the family physicians see today in their offices or on the wards in the hospital. But there's also the medical environment, I think, needs to be encouraged to be a collaborative care model, that you graduate it from medical training into a program of collaborative care, because we can learn a lot from one another as we go along. We don't have to know it all the first day we start to see patients.
Well, I think that's one of the great things about continuing medical education, really, is the idea that you don't have to know everything when you graduate. And in fact, I think you would probably say a lot has changed in medicine in 40 years. You wouldn't want to be practicing the same way now that you practiced 40 years ago.
No, and actually you find sometimes in continuing medical education, as it's gone on over the years, is that what you learned, you moved away from, and you're now back in the circle of, oh, no, that wasn't the bad thing to do that we thought.
What about the medical school? Have you noticed changes at the medical school in terms of maybe the focus of continuing professional development or continuing medical education?
Over time, we still use large group gatherings of physicians with didactic presentations and intense question and answer periods to try as a I'm going to say a backdrop in medical education or in continuing medical education. There was a lot of work done in the late 1980s, early 1990s at McMaster by a Dr. John Premy, and John developed small group learning activities and a program of writing case-based education around specific topics like hypertension or diabetes, or one my group did yesterday on obsessive compulsive disorder. So those that small group learning, and I would echo personally that I think that it is an excellent form of education. You have a module that you go through. with cases that you go through. The cases are very similar to what we see day to day in family practice. And we get to share how we would solve the problems here in our own community, which is very, very helpful. So that has been a major change in medical education. So small group learning and simulation. Simulation has taken off and is excellent in some hands-on programs that need to be brought up to standard.
So, Mike, when you think about your career, you've really managed to very successfully, I think, balance being a busy family physician out in the Fall River area. You've referred patients to me at the clinic in Sackville, so I know that you're always involved in patient care, and yet you've had all these leadership roles and had a really impressive administrative career as well. What advice would you give to young physicians who are trying to balance both the clinical and leadership aspects of their career?
Well, I think the first thing that comes to mind is pick the right spouse. My wife, Isabel, has been very, very supportive, and my kids have been very supportive of my activities in medicine and outside of medicine, or various aspects of medicine that I've been involved with over the years. I think I would not have been able to do the things that I have been able to do if I didn't work in a collaborative care environment. So I have worked with and shared call with a large group of family physicians over the years, which have allowed me to be away and do things, and yet my patients and my practice is covered. And so that's an important aspect of being able to think about being able to do the various things that I've been able to do over the years. So it's the supportive environment of my colleagues, my family, that has allowed me the flexibility to be able to participate. I mean, just to turn around and say that there is a little bit of payback that we need to our profession, and it's just to be involved, to try and get involved in the things that you are interested in, and that may lead on to more roles that you can play as time goes on.
Thanks so much for speaking with us today, Mike. It's been a pleasure working with you over the last, 10 years or so that we've been colleagues here at the medical school. And I understand you're retiring imminently.
The end of December is the go-to date. We'll see how that works.
Well, I wish you a very happy and successful retirement. Knowing you, I'm sure you'll find lots of things to keep yourself occupied. So
thank you.
And that's another episode of Leadership PRN. If you have a topic you would like to hear me cover, please feel free to reach out to me at lara.hazelton@dal.ca or lara.hazelton@nshealth.ca. Until next time, take care.